So November 3rd, we currently have 4,981 cases, 70 deaths. 1,204 of those cases are active and 3,707 are recovered. So our case fatality rate remains at 1.4%. And all of that monitoring you see below is between our staff and state trace force contract staff doing all of the contact tracing and monitoring folks who have been exposed. We changed our hospitalizations when we talk about this a little bit. One, I think it's important for us to know what the hospital capacity is in our community, not just how many Ingham County residents are in the hospital. So when we look at the total capacity of our hospitals, we can look at suspect and confirmed cases at Sparrow or McLaren, currently 91, and then those confirmed cases, which are 82, and 19 of those are in the ICU. The others are what we would say on the hospital floor. So they're in regular rooms, not ICU. 19 in the ICU, 9 of those ventilated. Yesterday, we had 40 emergency department visits that were COVID related. So that number is a number that I can accurately and reliably always give you out of a system that the hospital used to track capacity, to divert if they need to divert, all of those sorts of things. They also have mandatory reporting related to all of this. And so the template changed based on requirements of federal DHHS a while ago to allow all these numbers to be in there. And I don't have some historical numbers, but we were reporting to you before Ingham County residents who were hospitalized and tracking them. Now that doesn't necessarily accurately reflect what's going on in our health systems. The other problem is that when we had low numbers of cases, we were able to do that fairly readily. I don't have a system that I can query and say how many Ingham County residents are in the hospital right now. That was happening based on each one of our case investigators when they call cases or are tracking cases while they're still active, because we call them multiple times, will know if one of their cases is in the hospital or not. They will write that in notes. Every day they send an email summarizing all of their cases that they're tracking for the day. And then our data people were reading all of those emails and trying to glean those hospitalizations out of that. As case counts increased on us in September, I started noticing that that number didn't jive with what was going on within our health systems and what we saw related to transmission. So we did switch to this instead, because quite honestly, there just is no database that is going to accurately give me these numbers, nor can our staff read through hundreds and hundreds of case investigation notes every day and accurately always have that hospitalization number down. On top of that, when our case investigation staff get really, really busy, there may be a time that they forget to add that note about a hospitalization or a release from the hospital. And so that number is just not going to be accurate for us. This number is. Now, once a week, just before this briefing, I also hope to tell you how many of those people are Ingham County residents. So as of yesterday, when that hospitalization number was 76 instead of 82, 31 of those were Ingham County residents. So about 41% of our hospitalizations currently are Ingham County residents, which would be about expected, that with being the county of the largest population in our community, that we would have probably by percent the largest number. I mean, obviously it's not over 50%, but we'll have the largest percent of patients in the hospital, and that bears to be true when you know that Ingham County residents make up about 41% of this. So that was yesterday. Obviously we have an additional 6 cases confirmed in the hospital today. So, that 41% is probably still awfully close, but we will have that number once a week. It will not be on our website anymore. What will be on our website from now on is this, because really and truly, though we were giving you that hospitalization number and as case counts were low and all that sort of stuff, it was very accurate and it was very reflective. And when they started going up, it was a very strong indication that those hospitalizations were going up in September. As they started to come down, I began to wonder what was up. And I realized that what was up is my entire team is just so busy, and the way that we were gleaning this information, just with this many cases and this many emails flying around, is just not a reliable way to give you those numbers on a regular basis. This number I can give every day, and we will create charts from it every day. And like I said, once a week, we will get from Sparrow and McLaren, a number of Ingham County residents that are in the hospital. And that'll give us just a general idea of the percent that we represent within those hospitalizations on a weekly basis. And I would say that, on a weekly basis, those numbers, that percent should be, fairly reliable in telling us, about how many Ingham County residents are in the hospital. So sorry for the long explanation, but we did do kind of a shift for you on how we were reporting this data. And I wanted to make sure that, one, you understood why, that we didn't do it because we were trying to hide something. We didn't all of a sudden decide that there were 2 or 3 people from Ingham County in the hospital and all of a sudden it's 31. We just realized that, in the just incredible amount of work, case investigations, contact tracing, calling people on the phone. Sometimes people are in the hospital and out and we haven't even talked to them yet, that we just did not have a reliable system. This system is always going to be reliable. So based on that system, here is what our hospitalizations have looked like from April through to today. So we did go back, and even though they changed the template in the system that is recording this, it's called EM Resources. So we have this trend in hospitalizations. Now, EM Resources, as of August 3rd, 4th, started utilizing a new template so that we have more information about how many people are in ICU that are COVID, how many people are COVID and ventilated, those sorts of things. Those numbers weren't in here before. All we had was confirmed and suspected cases, and then just total ICU and total ventilated. It didn't tell us what they were in ICU for or ventilated for. Now the new template does allow us to say, okay, how many people do we have starting August 4th in the hospital, either in the hospital floor or an ICU. So you see that stacked bar there giving you a total. And then the red line down at the bottom shows you how many are on ventilators at any given time. And the brighter pink line up here on the top is that number of emergency department visits per day. And again, that data is coming from a system called EM Resources. It's an EMS-based system that helps our hospitals know when they need to go on diversion, when they're getting close to capacity, helps our whole EMS system know what's going on with the different hospitals in order to basically deal with that when they're accounting for transports and things like that. So this is where we are with hospitalizations right now from Sparrow and McLaren. And again, like I said, though we were giving you Ingham County residents before, the thing that we're really trying to track here is what is our health system capacity in this county, which means what are the 2 health systems in our county, Sparrow and McLaren, and how full are they? How full are they with COVID patients? And this truly gives you a better picture of that. So when we look now at our cases, we're going to be giving you active, deceased, and recovered. Now, there's a reason for that too. So 74.4% of our cases are recovered, 24.2% are active, and 1.4% deceased. We used to have hospitalization on here too, and those were current hospitalizations, but that 74.4% as well as that 1.4% are cumulative numbers. So as those numbers get bigger and bigger and bigger, and you look at a snapshot of how many people are in the hospital on a single day, you can't put hospitalizations on a single day compared to cumulative cases over time. That is also not a good way to present the data. So a better way to present the data for you now is to talk about hospitalizations, which we did in the previous slide, and then to basically tell you how many active cases do we have in the county right now, whether they're hospitalized or not, and how many have recovered, and how many are deceased. So that is what we will do with this chart here. Cumulative case counts. So you will see, we had that sharp rise here as cases shot up in September, and we are still, basically on a rise. It's not quite as sharp of one, but cases are increasing. They're just not increasing as rapidly as they were during this period of time, and they're certainly not flattening out like they did here. So when we look at our incidence curve over time, this is Ingham County cases and numbers per day. So we did exceed 120 per day on a few days there in September, and have many other days that were, well above 60 cases per day, which is quite a number of cases to be dealing with per day. As of right now, we are still dealing with 40 to 60 cases per day. When we look at the percent positivity, you can see that too kind of bounced up through the middle of September when cases came up. It's kind of going back down, and that also is trending back up. So when we look at both of those numbers in a 7-day rolling average, the gray bars in the back here are that incidence curve where we see this large outbreak that we had that came down, and then we leveled off, but we seem to be on a slight gradual trend upward. And also you'll see that our percent positivity is on a little bit of a trend upward, where we're sitting right now at a little over 5%. And we'd like to be more like 3%. 5% isn't horrible. I start to think about 7 to 10%, and that starts to make me nervous. So when we look at those cases by zip code, we still are looking at 1,830 to 1,840 of our cases in 48823. Then we drop all the way down to 651, 660 in 48911, then again to 48910, and so on. We still have a number of zip codes that don't have any more than 20 cases in it. And when we go to calculate rates, when we have less than 20, we can't do a reliable rate calculation. So when we do our rate map for you here, all of those zip codes that don't have at least 20 cases are just not shaded in at all. Or they're shaded in this very faint color. So we're just putting them in that just very low number. And so we see that our East Lansing zip code, highest number of cases, highest rate, followed by 48911. And then this would be 48910, 488, I think it's 54 and 64. And then this is 48906 here. So as we look at that heat map, we still see, because of that huge difference in the number of cases when you're looking at 1,800 compared to 600 in any other zip code, you see that strong heat spot in the East Lansing area, really mostly right across from MSU campus in that pretty concentrated part of East Lansing, because the East Lansing zip code actually is all of this, goes into Clinton County, in fact. And then these spots over here used to be brighter yellow, and as you see, there's a fairly intense spot there as well. But the magnitude of the heat in the other areas of our county now have basically kind of lightened the heat in the other areas. But if we do zoom in one more time in the East Lansing zip code, you can see some of these spots. When you see these spots right here that are kind of these perfect concentric circles instead of these little shapes, it's generally an apartment complex. So this is an apartment complex just to the west of campus, or down Michigan Road, just barely in a Lansing zip code here near Frandor. These are a couple of apartment complexes over here. This is that Water's Edge area. I believe this is Campus View apartments right in here. So fortunately, this is a 50-50 thing, so I don't have to imagine what those numbers would be. So 50% of our cases are male and 50% are female. So the labels are missing from this graph. My apologies. So that's what that's supposed to say, is male and female, and you're 50-50. Then if we look at cases by age group, we are still looking at that 20 to 29 age group now at 38% of our cases. I believe we topped out at 42%. So you can see, we're starting to have that, significant outbreak in our 18 to 24-year-old age group, which is also represented in that 10 to 19 bar, start to come down a little bit as other cases are now coming up in some of the other age groups. So 30 to 39, 50 to 59 at 10 and 9%. So if we look at cases by race, 66% are Caucasian, 14% are Black or African American, 6% Asian, 12% other. and 3% unknown. Other typically is Native Hawaiian, Pacific, anyway, and Eskimos and American Indian or American natives, Native Americans, excuse me. Some of our others also are, I have to say, when we do demographics within the public health system, Hispanic or Latino is not a race, it's an ethnicity. Now, when we see death certificates, sometimes we will see people list Hispanic or Latino as not only their race, but also their ethnicity. And the public health world just doesn't jive with that, nor does census information. So if you look at the census, you won't see Latino or Hispanic listed as a race, you'll see it listed as a ethnicity. There are many Latinos who do not identify as Caucasian, nor do they identify as Black. And so they kind of sometimes struggle, and those sometimes become others. So some of these others are truly Latinos or Hispanics that do not identify as Caucasian and do not identify as Black or African American. So when we look at rates, our Caucasian rate at 1521 versus African American at 2065, that's a 1.36 times, so 1.36 fold, or a 36% difference between our African American population and our Caucasian population. And we're pretty even with our Asian population and our Caucasian population at this point in time. When we look by ethnicity, 81.7% are not Hispanic or Latino, 8.7% are Hispanic or Latino, and 9.6% unknown. So that too, when we look at the Hispanic or Latino rate at 1868, rounding up 1869 compared to 1509, that's a 24% difference. 24% difference, I believe, between those two. Maybe I've got those numbers off. It's 1.24 times. Maybe that's 2.4%. I don't know. My brain is tired today. I'm sorry, folks. So now when we talk about our deaths, we now are up to 70 deaths. That means we've had 30 since September 8th. So I think it's important to note that between the beginning of this pandemic and close to the end of July, I think we had a death on July 27th. We had 29 deaths. We now have had 30 deaths since September 8th in this county. So you look at our hospitalizations, you look at our deaths right now, and increased transmission, broad scale community transmission ultimately leads to increased hospitalizations and increased deaths. And we definitely did see that. When we look at these deaths by sex, they are 52.9% male, 47.1% female. When we look at deaths by race, we are 24.3% African American, 70% Caucasian, 1.4% Asian, 1.4% other, and 2.9% unknown. When we look at deaths by ethnicity, we are 88.6% not Hispanic or Latino, 5.7% Hispanic or Latino, 5.7% unknown. And then these are our MSU related cases by date of onset. So you can see that, you know, we really have kind of come to the tail end of that outbreak. Their positivity is now starting to trend, you know, closer to matching with the county level positivity. You can see that now on this graph where positivity is coming down. This is that 5% or so that we are seeing in the county as well. And then MSU will continue to display this on their website, cases by week. So probably moving forward, we will continue to show you this MSU related cases by week. It's probably unnecessary for us to show you all of the other slides as we kind of get to a point where that is, you know, not really the most significant thing happening in this community right now. We really are looking at just kind of general, broad, widespread transmission in the community. And then this is that cumulative case count where you saw this increase here paralleled this increase here. This has leveled out as this has continued to rise. So that is where we are today. And a little bit of explanation about data and shifting in some of our data, some of what we're showing, just to make sure that you understand that there was nothing intentional about that in terms of trying to, minimize, the number of hospitalizations or anything like that in Ingham County, or not report those numbers, but truly to give you a number that, one, is reliable, and two, is really a reflection of the capacity of our health systems in this county, which is really the important thing we should be paying attention to.
Thank you, Linda. Does anyone have any questions at this time? I don't have anyone in the queue, so if you have a question, go ahead. Go ahead, Robin.
Robin, can you hear me okay? I'm having terrible computer problems today.
I hear you okay. You're okay, but I'll listen close.
Okay. You're talking about hospital capacity, and I see your lines and your numbers, but it's hard to tell what that means if you don't have an overall picture of the hospitals. And so I'm wondering, have you talked about, just in general, what does capacity look like right now? And are you hearing from the hospitals?
We are hearing from our hospitals that they are getting close to what they call their census. They're starting to max out in terms of their census. Unfortunately, and I don't want to point fingers, back before they changed the 20 template, one of the things I could see was total beds in the hospital and total occupied beds in the hospital, no matter what it was, and then number of COVID patients. But I didn't get the breakdown of how many ICU COVID patients and how many ventilated COVID patients. So what it told me was total hospital capacity, total occupied beds, total ICU capacity, total ICU occupied beds, total ventilators available, total ventilators in use. And then it told me total confirmed and, I believe, suspect or are under investigation COVID cases. But it didn't break down the ICU numbers or any of that. So that was one other issue. When they changed the reporting template in August, they dropped out all of the numbers that tell me what the total bed capacity is in the hospital and how many beds are currently occupied, no matter what they're occupied from. So the numbers I see now are just these COVID numbers. They do have the influenza numbers in there too. So as we get to a point where during influenza season, we might expect to see some hospitalizations and things like that related to influenza. Those numbers are there. Those numbers currently are 0. So that's the other number we'll be able to see. We have to reach out to our hospital partners to get, from them, how are they with regard to, reaching, their census or being pushed to, close to full capacity at the health systems. I think, all other things being normal, and then you see these case counts or these hospitalizations related to COVID going up, that certainly is a pretty clear sign that they're starting to be stretched. But unfortunately, again, I don't have a system to give you that number. You'd have to, as a reporter, get them from the hospitals. Sorry.
Thank you. Go ahead, Hope.
I was just wondering if you could tell me about what eventual vaccine distribution would look like in Ingham County and how that would potentially help mitigate this community spread that you're saying we're seeing an increase of.
Well, I mean, clearly we hope that a vaccine is going to provide immunity to folks, or at least a degree of immunity. I mean, as we know, a flu vaccine has a certain level of effectiveness. It's not 100% effective. And, we might encounter that with this vaccine too. It also is probably going to be a 2-dose vaccine. Distribution in the community is, I mean, we have giant plans for, mass vaccination clinics and things like that. We did that during H1N1, so I would expect to see a distribution plan that looks similar to what happened with H1N1. Although I can tell you that vaccine distribution is going basically to prioritize first. So you're going to see vaccinations going on with healthcare workers, as well as in long-term care facilities, and some other vulnerable populations is where that initial vaccine that gets deployed will be targeted. And then as the vaccine continues to come into the communities, then there'll be broader scale vaccination clinics. They will be, I'm seeing availability is going to be at pharmacies, so pharmacies will be able to do it as well. You know, when we had the mass vaccinations before, everything kind of came to health departments and we kind of had to be responsible for getting it out there. We didn't have a lot of those partnerships together. So I'm seeing a lot of that happening with regards to conversation about the vaccine and where it's being deployed to. Even our long-term care facilities are like matching up or pairing up with pharmacy partners in order to do the vaccinations in those long-term care facilities. There are some that are identified, or if the long-term care facility has one they prefer to use, they can identify one. So that's kind of what I know right now, which isn't a full answer to your question, but we would expect with a vaccine, especially what we need is good uptake with the vaccine. In other words, people getting vaccinated, we should see some ability to control community transmission through vaccination.
Awesome, thank you.
Mm-hmm.
Does anyone have any questions at this time? Go ahead, Rachel Sweet.
Hello, I have a question about Election Day. I'm asking kind of what were some of the things that you spoke with election polls to get ready for the safety to prevent the spread of COVID-19?
So Barb Byram is our county clerk, and she basically kind of, seems to me anyway, I don't know her business, she seems to assist all the clerks with basically pulling together and training and all that sort of stuff. So she pulled together a meeting early on with all of the clerks and election officials, all of the different polling places to talk about, you know, what do we need to do and how do we need to be safe? And they came up with lots of plans. You know, they've got, you know, plans around distancing to the extent that they can. They will all be wearing face coverings. The machines will get messed up if you disinfect them, so please don't disinfect the machines yourself. They've got, I don't know if you recall, I mean, every time I've gone in and voted, you walk up to one table and you fill out something, and then you put that pencil down, and you walk over to another table and you fill out something else, and you put that one down, and then you walk over to the you know, poll, and then you know, color in all the dots with yet another one. So your pen is following you through the process now. It gets to the end and it gets put into a pail where it gets disinfected and comes back. They are a lot of times they do pizza or whatever. We were like, you know, you can't bring in pizza. People, you need to bring in box lunches, or people need to bring their lunches. We can't require people to wear masks at polling places, because requiring them to wear masks would inherently say, if you don't wear one, we won't let you vote, and you can't do that, nor should you. So they have a good number of safety protocols in place. They've Clerk Swope for the city of Lansing, as well as Clerk Bylam, have reached out to me on a number of different occasions about their plans. And like I said, they've been working with all of the other clerks. So we did a little bit of a training session with them quite a while back, actually before the primary in August.
Okay, so do you feel safe, even though with all the long lines and people going through after, if there'd be any COVID case increase in the area, if people are going out?
Well, there's always, you know, there is nothing that is no risk, right? To me, the extent to which people are, you know, avoiding grouping together, maintaining that distancing, wearing the face coverings is going to help us mitigate the risk at the polling places. And to the extent where people just refuse to do that, that is going to be where we're going to see increased levels of risk and perhaps related to voting. But it's going to be hard to tell at this point in time. I mean, you know, we've had protests at the Capitol and stuff like that that haven't led to significant increases in cases. We have seen some communities that have seen increased transmission in the 2 weeks following some of the rallies, political rallies that have happened. So, you know, you're asking me to guess. We're just, you know, we're hunkering down. We're doing everything we can. We have worked with the clerks. We have put messaging out to the public. We have, of course, encouraged, you know, absentee voting and, you know, mail in your absentee ballot early kind of voting. Drop it off at the clerk's office. I dropped mine off. I didn't mail it. Certainly, if you didn't send it in until late, you should have dropped it off, but I felt more comfortable just dropping it off in the first place. So, you know, all of that, you know, leads to, I mean, as you can see, what was it? It's close to 100 million votes had already been cast before we got to election day today. And I believe last election, we saw a total of about 130 million, 135 million votes. So quite a number of votes have been already cast. So hopefully that will keep those numbers down at the polls. We certainly want to see the polls. We want to see people voting. We absolutely do not want to in any way, shape, or form discourage people from voting. So we've encouraged people to vote in safe ways. Now we're on election day. We're encouraging people to vote in person in safe ways now.
Awesome. If no one has any other questions, could I ask something else?
Go ahead.
Are you, when people come in to go vote, are they doing temperature checks before they come in or anything like that?
No,
No. Okay. Is there anything else you'd like to say to people that
they
are
are,
heading up?
they are doing that with poll workers. So our
Okay.
people who are working the polls are being screened and did have temperature checks. So that screening that we use for people in employment places, that is happening, but not for voters.
Okay. Would you like to say anything to people going out to vote in Ingham County?
I just, one, vote, please vote. Two, no matter what which side of that you are on, science says that social distancing, trying not to be in large indoor crowds, wearing masks if you are in those indoor areas as well, face coverings, as well as maintaining that social distancing is going to mitigate risk to a large extent. So please do that. If you are somebody who basically is absolutely adamant that the science of masks is believable and is real, which is, in my opinion, true, then if you go to the polls and you find that you are in an uncomfortable position with regard to people around you that are not staying distance and are not wearing face coverings, then talk to a poll worker, find a less crowded time to go. There are definitely times when voting at the polls is not as crowded as other times, and there are probably plenty of you that could tell me what those times are, because I'm sure you've covered many elections, and I just do public health. So
Awesome. Thank you so much.
I have a question from Robin Erb through the chat box. She says, were there discussions among MELF members about reducing COVID transmission at the ballot or some other state level discussion involving public health? Or are these conversations between local health officials and elections officials?
Well, I think there's been a lot of messaging at the state level as well. So, we didn't invent all that messaging ourselves. That messaging has been at the state level. The messaging, we've heard the governor and everybody else talking about get out to vote and voting safely, voting early, voting absentee, getting your ballots into the clerk's office, and all of those sorts of things. So I'm not really sure how to answer that other than, we definitely are parallel messaging, whether in terms of like direct conversations regarding, okay, what's everybody going to do about voting? I would guess that that's been happening probably between Secretary of State, Secretary of State Jocelyn Benson's office, along with the county clerks, and then from the county clerks on down to the relative city and township clerks and all of that. So I'm guessing that most of those conversations were held at that level, after, of course, consultation with folks at MDHHS. And then, like I said, we just kind of jumped in at the local level and did our best to help our locals with all of their questions, concerns, and ideas about what they could do in order to make sure people were as safe as possible voting on election day.
Thank you. We currently have no questions in the queue. If you have a question, please go ahead. Last call for questions for Ingham County Health Officer Linda Vail.
Hi there, I had a quick question.
Go ahead.
Is the health department expecting an uptick in cases in the coming weeks due to that short burst of gatherers in downtown East Lansing after the football game?
We've had a presidential rally at the airport. We got voting going on. We've got an MSU U of M football game that turned into a little bit of craziness after the game ended. And, you know, it's just really hard to predict, you know, what will directly happen as a result of all of that. I think the most important message right now is not to be kind of zoning in for outbreaks or whatever. We have broad and widespread community transmission. We're back at the point where people need to think that it's not a matter of identifying COVID here or somewhere else in order to avoid that place or whatever. We have COVID broadly across this community. And so I think we gave messages early on about, you know, when you go out and about, instead of trying to avoid a place that you might have heard there was a case here or wherever, you should just assume that there is the likelihood for COVID exposure almost anywhere at this point in time. And you can mitigate that risk of your exposure by avoiding gatherings, large gatherings, particularly indoors, by wearing a face covering, by maintaining that social distancing, and by washing your hands and not touching your face. So I think really more, and not to just not answer your question, but, you know, you're asking me to guess. I have no idea. What I know is we have a lot of transmission in this community right now, and exactly what it is that might drive it, I have no idea. I mean, we saw that huge outbreak in September that was MSU related as MSU students came back to campus. Whether something or this combination of things will shoot cases up like that again, or whether we'll just continue to ride what is really broad scale community transmission, it's really hard to tell.